We're telling about the good work that we've been doing in Finland really with HIV positives, and especially how easy it's to get treatment and help if you are tested HIV positive in our drop-in center. So you can just really walk into our clinic and get all the services, and it's also telling now how well it has worked, because we are getting so few positive HIVs, IDUs nowadays, only 10 last year, so we are doing good and meeting people that think the same way, and you get more force to your work, and you remember why you are doing this job. We conquer the whole world this way.
My poster is prevention of HIV AIDS among injecting drug users, vulnerable population in Mombasa, Kenya. This is after the significantly increase of people using heroin within the coastal region. To be specific, Mombasa is a major East African commercial port. So with this, we have seen a significant number of people also injecting now. So this program is trying to reach out to them now.
Jambo, we're having a good time. Asanteni. Go on, you say something now.
Habari zenu, na tunaitwa Taib kutoka Kenya, Mombasa. So we're here to
talk about the work.
Yeah, the work, and we're having a lot of information from different countries and different programs that are very healthy and productive back home to take.
And much needed.
It's really encouraging to see more and more young people and people from different regions becoming a part of the movement. And we are conducting a qualitative study after interviewing treatment providers and patient advocates. We're finding treatment providers have no seat at the table. They were not involved in the establishing the courts in any of the counties we've visited or discussed with people. They don't have a say in their policies. They haven't been visited by the courts, nor have the courts invited them to present and teach them about opioid substitution treatment. So there's a real lack of cooperation and collaboration.
This post is about drug use in Bali, and one of the things about drug users as compared to other key populations, risk populations, is drug users are often involved in a range of different groups, both law enforcement, health services, and also NGOs. So your opportunity for counting and measuring them through these different institutions and organisations is much greater. And we did a good mapping study earlier in 2002, 2003, and we followed the same study up in 2009, 2010, and we found really quite a dramatic drop in HIV.
This is actually my first international conference, and it's been great because there's such a diversity of people here, people doing research, people doing outreach and intervention, really on the front lines, and it's been really interesting to hear about their work and a lot of the innovative approaches they're using in harm reduction. A lot of the discussions during this conference have focused on drug detention centers in Asia. The issue has sort of been that a lot of these reports have been based on information collected outside of the facility, so based on interviews with former detainees. And this has made it a little bit harder to advocate for change of this model. And so what we did in this study is that we were fortunate to get access to these drug detention centers in Malaysia. I actually lived in one of the detention centers for about 10 days doing data collection there. And we surveyed detainees and looked at their health status and whether they're able to access treatment and care, focusing specifically on detainees with HIV. We're really seeing that people are dying from preventable illnesses while being incarcerated. And in the time that it takes to shut these facilities down, it may take a while. We can't turn our backs on the fact that people are suffering and dying in these facilities themselves. And we need to find a way to scale up medical care and treatment in these settings, alongside advocating for this model to be changed.
So what we did is we recruited a whole bunch of people who just got out of prison, 141. And we wanted to follow them over 6 months. And we did this because we wanted to look at, overall we wanted to look at the barriers and enablers to treatment access and health service and social service access by people after they got out of prison. There's such a lack of support out there for people pre and post release, and people just don't have the knowledge of where to go. So it's just, and sort of adopting a through care model, having the support for them pre-release and continuing that into the community with appropriate referrals to relevant services. The networking is great. It's terrific meeting other people who are involved in so many interesting projects around the world. It's inspiring.